I'm Leonardo Kayat Bittencourt, an abdominal radiologist by training, subspecialized in genitourinary and prostate imaging. Abdominal imaging, just like everything else in radiology, is evolving and progressing into becoming more quantitative, into allowing for extraction of richer information that will help us get pieces of information that are not yet available on morphologic-based imaging only. The adoption of clinical AI by the radiologists has to do with the AI applications showing how they can help radiologists in performing their tasks. Any AI that makes the radiologist's life easier and thus improving the patient's outcomes is the one that will be more likely to be adopted. We have challenges such as a lack of standardization of protocols across practices that limit the immediate applicability of algorithms in different centers, limitations from the data security and privacy, issues with trust between practitioners and patients that need to be solved. Radiologists who use AI will replace those who don't or who refrain to do so. In our institution, we are driving clinical AI adoption through a series of collaborations with the industry in that they are bringing their emerging technologies to us. So we are getting there very early in the game. And in different subspecialties with different clinical champions in our department, we are interacting with those technologies and affecting and improving those products by our data and by our people, and then getting to use them in clinical practice to the benefit of our patients. It's very important, it is key that the departments, especially the academic departments, they interact more and more with the industry that is bringing this kind of innovation. So when we think of data-driven diagnostics and the increased automation and digitization of medicine, some of the repetitive tasks that we perform today, they're going to be automated and they're not going to be adding value to the chain of treatment and diagnosis as they are today. So of course that people will not be recognized or reimbursed for that. But still our role is going to be preserved in the sense that as the owners of the digital information of the patient and as of the specialists in understanding how this digital information based on imaging and based on other kinds of data points interferes and impacts the diagnosis and the treatment of our patients, the more we can use it to orchestrate those decisions, the better we're going to perform. The closer the radiologists get to the patient and to the delivery of care, the more valuable we will remain. So the radiologists that think that by only doing remote work that doesn't have any kind of physician-physician interaction or physician-patient interaction, those will probably be the most impacted. Whereas the radiologists that operate closer to the referring physicians, that operate closer to multidisciplinary teams, and especially the ones that better connect with the patients, are the ones who will remain indispensable. Introducing more and more information that is captured in the patient's exams, now that we know that images are data, and data that is much more than meets the eye, we get then to achieve more personalized diagnosis to drive patient-centered care. Another way that digitization of medicine and data-driven diagnosis impact healthcare, which is by improving increased and broader access to healthcare resources for people or communities who would not have that otherwise. So imagine that you are now able to deliver care and to perform complex examination at remote communities, locations where you needed very high level of technology and very high skilled personnel to perform it, but now you can perform them from a distance and have them semi or automatically read and then interpreted so that those patients can also have the same level of care as other patients in the big centers. I view this big movement of data-driven diagnosis, AI, radiomics, as the next revolution in radiology. During my training in residency, I was living the last revolution in radiology, which was the revolution from film to PACS. And I saw the impact that digital imaging made to patient care, to discovery of new techniques, new diseases, new areas, new modalities in radiology that appeared because of this transition. So I wonder what kind of new discoveries, of new improvements we can get from this yet new revolution. So I'm excited to be joining this revolution and to be promoting it and to be empowering that too.